Hello everyone, I am Loy McHugh and I'll be presenting on the article entitled Glass Ionomer Cements in Pediatric Dentistry Review of the Literature. During the presentation, the following points will be addressed: the title of the article, the authors of the article, the journal name and impact factor of the journal in which the article is cited, the date of publication of the article, the major topic discussed in the article, as well as the type of article, the main purpose of the article, the key points garnered from the article, as well as an assessment of the article, and lastly, references and questions. Now, the article is entitled Glass Ionomer Cements in Pediatric Dentistry Review of the Literature. The authors of the article are Drs. Theodore Kroll and Dr. John Nicholson. Now, the article is cited in the Pediatric Dentistry Journal, which is an official publication of the American Academy of Pediatric Dentistry. The Pediatric Dentistry Journal has an impact factor of 65 relative to the Lancet Journal that is based in the United Kingdom that has an impact factor of 747. The Nature Journal, also based in the United Kingdom, has an impact factor of 1,159. Now, impact factors measure the importance of a journal by calculating the number of times selected articles are cited over a number of years. The higher the impact factor, the more highly ranked the journal. Thus, the Pediatric Dentistry Journal will be considered lesser ranked relative to the Lancet Journal as well as the Nature Journal. The article was published in the year 2002. Now, the major topic covered in the article had to do with restorative dentistry. Now, this is a branch of dentistry that involves the restoration of diseased, injured, or abnormal teeth to normal function. Restoration is done by means of metallic or non-metallic materials, which would include amalgam, resins, inlays, onlays, synthetic porcelain materials, and glass ionomer cements. Now, glass ionomer cements were the major topic of focus in the article, and these are used in different restorative procedures for teeth as well as for cementation purposes. They are luting cements and they cement stainless steel crowns as well as orthodontic brackets to tooth structure. Now, the article being analyzed was found in the level of expert opinion in the evidence pyramid that will be shown later on in the presentation. Now, the information and guidelines promoting best practices were promoted by experts in their relevant fields in the article, and the experts were dental clinicians and their relevant field was dentistry. Now, an example of information that would have been presented by these experts included that of the setting reactions for self-hardening glass ionomer cements, as well as discussion of the benefits deduced. Another example of information that was given out by these experts would be the conferred properties on glass ionomer cements when elemental silver and silver amalgam powder were added. So there was much disinterest shown by dental clinicians in utilizing the original glass ionomer system to treat children. These materials required increased setting time and were vulnerable to being dissolved or dried out during the hardening reaction. Once hardened, the materials also showed poor wear resistance and fracture strengths. Despite the benefits that the glass ionomer cements conferred, which would have included similar coefficient of thermal expansion to tooth structure, its ability to release fluoride as well as participate in fluoride uptake, and its good biocompatibility with oral tissues, as well as its ability to form chemical bonds with teeth, dentists were still unwilling to use it due to factors such as poor durability over time. The authors of this article thus reviewed the development and history of glass polyalkanoate cement systems or glass ionomer cement systems and their ongoing role in dentistry for children. Now, the key points garnered from the article are as follows. Glass ionomer cements are also called glass polyalkanoate cements. They are made up of acid and base material, and the acid is water-soluble polymer, and the base is either calcium or strontium aluminum fluorosilicate glass. Glass ionomer cements also form chemical bonds with enamel and dentin. Now, these chemical bonds are owed to the formation of ionic bonds between the carboxyl group of the polyacid and the calcium of hydroxyapatite crystals in the tooth structure. The bonds are more strong to enamel rather than to dentin due to the greater inorganic content of enamel. Glass ionomer cements also provide good biocompatibility. They are biocompatible with pulp and surrounding tissues. The use of glass ionomer cements is also deemed important in children and high caries risk patients. Furthermore, glass ionomer cements used for children are classified as lutein cements or restorative cements. Now, restorative cements are either metal modified, resin modified, self-hardening, or partially light hardening. Glass ionomer cements are self-hardening and some are modified with resin. Self-hardening glass ionomers set wholly by a neutralization reaction to give brittle materials, and self-hardening glass ionomer cements are also more biocompatible with oral tissues than resin-modified glass ionomer cements. Furthermore, the resin-modified glass ionomer cements set partly by polymerization and partly by neutralization to give slightly harder materials. And overall, resin-modified glass ionomer cements give more aesthetically pleasing results. Now, silver was also added to glass ionomer cement, and this increased the radioactivity and wear resistance of the material. And Kita Silver is a brand of this product that was produced. Use of Ketac silver, however, decreased with the introduction of resin-modified glass ionomers. Now, this is an image depicting the bottle as well as the box in which the Ketac silver powder would come. Now, a major brand of the resin-modified glass ionomer is termed as Vitribond. Now, the properties of Vitribond include it being an antimicrobial agent, its release of fluoride ions, as well as it preventing sensitivity after dental procedures. Now, in preventing post-operative sensitivity, it would be placed under resin-based composite restorations and protect the dentinal tubules against bacterial access. Resin addition to glass ionomer cements decreased the initial hardening time when utilizing the material, increased wear resistance, improved fracture resistance, improved fracture toughness of the material as well, and decreased handling challenges. Now this is a picture of the Vitribond product, which is supplied in powder and liquid format, and it would have to be spatulated by the hand when powder and liquid are dispensed. The liquid polyacid component includes a photopolymerizable resin that hardens the material to a great extent when the material is being cured by light. Now, glass ionomer cements release fluorides over extended periods, and some researchers describe these extended periods as 5 years or so on. They're also taken up by enamel and dentine. So with fluoride ions being taken up by enamel and dentine, this would render the tooth structure less vulnerable to acid attack, as the solubility of tooth structure will be reduced, as well as bacterial action disrupted, and thus acid production that would result from bacterial action would stop. The glass ionomer cements also function as fluoride reservoirs, right? So they take up the fluoride ions from dentifrices as well as mouthwashes and so forth, and store them over a period of time and release them slowly. Now, as it relates to glass ionomer luting cements, these bond stainless steel crowns, orthodontic brackets, orthodontic bands, and space maintainers to tooth structure or oral tissue. And there's now a resin component that is included in the glass ionomer luting cements. Glass ionomer is also combined with resin-based composites, and this material is used in a sandwich or lamination technique in children and adolescents. So in this technique, glass ionomer replaces the dentine and resin-based composite replaces the enamel. Now, the assessment of the article gave the following results. Level 5 evidence was presented in the article, and the article was at the level of expert opinion in the evidence-based pyramid that will be shown after this, and thus information in the article was possibly influenced by the personal beliefs and opinions of the authors. The evidence was thus of low quality, and it is likely that further research will alter the confidence in the estimate of the information presented in the article. Now, this is a picture of the evidence pyramid, which shows different study designs with increased quality of evidence as the pyramid is ascended. So as is shown, expert opinion is at the bottom of the pyramid, and it would have lower quality evidence relative to case control studies, as well as relative to cohort studies, and even systematic reviews. Now, as it relates to the use of glass ionomer cements in pediatric dentistry, Hitak Mola and Fuji IXGP are two glass ionomer cements that have better physical properties relative to self-hardening cements, and they set rapidly and are considered ideal for some uses in primary teeth and interim restorations in permanent teeth. These are just some of the uses of these two glass ionomer cements. Thus, with the implication of the use of glass ionomer cements in clinical dentistry, these two glass ionomer cements will be considered for use overall in the clinical dental setting. Now, these are my references, and there is no time for questions and answers, and thank you for viewing.